How can breast implants cause visible wrinkling? Imagine your skin as a soft, flexible cover over a smooth object. When that cover is thin or stretched tight, folds or ripples can become visible. That's essentially what happens with breast implants and visible wrinkling, also called rippling. This occurs when folds or wrinkles form on the surface of the implant and become noticeable through the skin. The main cause is not the implant itself but the amount of soft tissue covering it. If there isn't enough tissue over the implant, the shell's folds can show through the skin, especially in areas where the tissue is naturally thinner, like the sides, bottom, or near the cleavage. One big factor is the natural thickness of the breast tissue and skin. Patients with very little natural tissue or thin skin have less padding over the implant. This makes the edges or folds of the implant more visible or even palpable. The type of implant also matters. Saline implants tend to be more prone to rippling because they have a thinner outer shell and are filled with fluid that can shift or fold more easily. Silicone implants, especially those with cohesive gel or gummy bear consistency, tend to hold their shape better and are less likely to show ripples. Placement of the implant plays a role too. Implants placed above the muscle, known as subglandular placement, have less muscle coverage. This means less soft tissue to hide the implant's surface, increasing the chance of rippling. When implants are placed under the muscle, called submuscular placement, the muscle provides extra coverage, helping to mask any folds or ripples. The size of the implant is another important factor. If an implant is too large for the patient's natural tissue, it can stretch the skin and thin out the tissue, making rippling more visible. Conversely, if the implant is too small, it might not fill the pocket properly, allowing the shell to fold and become visible. Over time, changes like weight loss, aging, pregnancy, or breastfeeding can also thin the tissue and reduce skin elasticity, making rippling more noticeable even years after surgery. Additionally, the healing process creates a capsule of scar tissue around the implant. Sometimes this capsule contracts unevenly or tethers the implant, causing folds or distortions that look like rippling. From a plastic surgery perspective, careful planning can help reduce the risk. Choosing silicone over saline implants is often recommended because they are less prone to rippling. Placing the implant under the muscle increases coverage and hides surface irregularities. Selecting an implant size that fits the patient's body and tissue is also crucial. Some surgeons may suggest adding soft tissue padding through procedures like FAD, grafting to further reduce visibility. In summary, visible wrinkling happens when the implant shell's folds become visible through thin or insufficient tissue coverage. Factors like implant type, placement, size, and changes in the breast tissue over time all influence this. Proper surgical technique and thoughtful implant selection are essential to minimize this common concern and achieve natural-looking results. Always consult with a qualified plastic surgeon to discuss your individual needs and options for the best outcome.